Hello and thank you for watching my educational video on the Affordable Care Act, aka Obamacare. Today I'll be going over what's covered under the ACA, also what's not covered, and how you can join the over 16 million Americans who have already benefited under the new law. For your information, I am a certified healthcare representative and my ID number is 11206-123. And to get started, we're just going to open up a web browser. Whichever one you choose, we're going to go to enroll in Obama.care. So I'm going to open up Firefox, and we're going to go to enroll, ENROLLIN, Obama.care, and just hit enter. And that's going to bring us into a web portal where we're going to put in our zip code. So I'm going to put in 33710. And just hit find plans. From there, you're going to put in how you file your taxes. So if you are an individual, you are going to file as an individual. If you are married, you are going to file married. Even if the other person has a health insurance elsewhere, either through Medicare, Medicaid, or through an employer, you can add additional family members here in household size. So for this scenario, we're going to do a family of 3, 2 adults age 45, and 1 adult child age 20 that still lives in the house. And we're going to say that the family has a combined adjusted gross income of $25,000, which gives them a $759 discount per month. Based on where you live, you may qualify for a discount, and also based on your family size. So a family of 3 that makes above $20,090 per year and under $80,000 per year can qualify for a discount based on where they are. So the closer you are to 80, the more you pay. The closer you are to 20, the less you pay. Pretty simple. Pay what you can afford. So here you'll see the companies that are available in Pinellas County, Florida. The plans may change, the companies may change, but the principles all stay the same. So if you see that there are no checked boxes here, please call the number above at 844-622-6201 to make sure that your state is included in our hierarchy. So there are 4 different levels of plans: bronze, silver, gold, and platinum. Catastrophic, I've never really come across it. It's really just for people between the ages of 19 and 30, or those that qualify for an exemption. But here we're going to look at standard issue plans, such as the bronze. So what you'll see included in all plans are what's called the essential health benefits, such as maternity care, rehab, and mental health, things that were never included in healthcare before the Affordable Care Act came out and made them guaranteed in all policies. You'll also see that preventative and wellness services are included in all plans, but not only are they included in all plans, but they're also covered at 100%. So you do not have to pay for wellness visits, including pap smears, mammograms, colonoscopies, and annual checkups. What is subject to the deductible is non-preventative, accidents, and hospitalization. That's where your deductible comes into play. So if you go into the hospital and worst case scenario, you get a $100,000 bill, you would have to pay the first $4,200 at 100%, and then 40% out of pocket up until you paid $6,600. So there is your maximum out of pocket, and that's really what we need to focus on, because the deductible does not really mean anything, and you'll see why. So over 70% of plans that are chosen through the ACA are silver plans. Here we're going to see plans with very low deductibles because of the cost sharing aspect of these plans. Your deductibles get credited. So we're going to compare the top 3 plans. You can choose 4. If you want to see 4 side by side, we're just going to choose the top 3 that are under $100 per month, and we're going to go ahead and compare them. So you'll see 3 silver plans, all the same level, but 3 different companies with 3 different premiums. So we have a $0 plan with a $750 maximum out of pocket. So the most you'll have to pay in the event of a hospitalization is $750. So while this plan has a $0 deductible, you would have to pay 30% of all of your bills until you reached $2,000. And for $62, we could have an out-of-pocket maximum of $500. What differs from plan to plan is going to be what prescription drugs are covered, what doctors are in network, and how much you pay for copays. So you'll see here in the $0 plan, you have $25 copays for primary, $35 for specialist, and on the $42 plan, $5, and here there's no charge. So basically, you have to pay 100% out of pocket until you meet your deductible, and then after that, then you do not have to pay. And same goes for copays on generic brand and specialty prescriptions. For a full list of doctors, you can click on the doctor list. For a full list of prescriptions, you can click on the drug list. So what we're going to do here is go to an actual enrollment. So we are going to just make up a scenario. Here you're going to put in your information. We're going to do Jack Doe that lives at 1100 51st Street North. It should populate based on your zip code. Put in your email. If you don't have an email, please call and we can get around it, but we cannot enroll you through this portal. So here we're just going to fill in all the boxes. If you prefer to be contacted through email, you can have that here. If not, you can change it to mail. And we are going to apply for lower cost plans, since we know that we should qualify for a discount. So Jack is a male, and his date of birth is 1960, and just put in your social. Jack is married, and he files his taxes jointly. We're going to say that Jack, after he pays his expenses, he's self-employed, he takes home $12,500 per year. And he is not currently enrolled in any plan. He has not been declined for Medicaid. The only reason why you see this here is because I am making this video outside of open enrollment. During open enrollment, it'll just be blank. So to get to the next screen, we are going to say that he is qualifying for a special enrollment because he is losing coverage, his family coverage, on July 30th. And his wife, Jane Doe, is a female. I'm going to say they have the same date of birth and very different socials. She is also married, and she also files her taxes jointly. And we are going to say that she makes $12,500 per year, but she works for an employer. So when you work for a company, they want to know who your company is. We're just going to throw in Walmart, and you just put in the phone number that is best to your job. If you have any additional income, you can add it here. If not, we're just going to go through and say that we are not qualified. We are not currently enrolled in any plans. We are also losing coverage on the 30th of July. And we are going to include our adult child who still lives at home. He's a student in college, and his name is Jack Jr., and he is a male with a date of birth of 1995. If you have a household member who you claim on your taxes but already has coverage elsewhere, you still add them here. It's just you just put no, and you don't need their social. You just need their name, obviously your relationship status, and their date of birth. So Jack is unmarried. He is a full-time student, and he is claimed as a dependent, and he has zero income. So no current coverage, and 30/2015 with the rest of the family, and we are going to continue. Oh, and junior. Forgot that. So anything that shows up in the system that is out of the norm is going to give you a red flag just to make sure that we're not putting in the incorrect information. And here you have your disclaimers. No one applying for coverage is in jail. That you give the marketplace to cross-reference the data that you put on this application to your tax return. If any changes, divorce, or if you become eligible for a plan, you can contact the marketplace and change it. Here, just going to say that no one has a gun to your head and is making you tell any lies, and you acknowledge that I, Jeffrey Mercado, am your agent. And then you will just click submit. What's going to happen there is you're going to receive your confirmation in your email along with your federal marketplace ID number, and within 10 to 14 days you're going to receive your ID cards and your first bill in the mail. Obviously, in this scenario there was 0 monthly premium due, but if there was something due, you'll receive your first bill and your package in the mail in 10 to 14 days. Please feel free to forward this video to your friends and family. Any questions, feel free to give us a call at 844-622-6201. Again, this is Jeffrey Mercado, and thank you for watching.